What is that one thing which has not changed when it comes to patients' perspective about diabetes? Back then, 30 years back also it was same, and today also it is same.
Dismay that how did I get diabetes?
Denial.
I don't eat sugar. That's it. Period. This has not changed. The second is fear. What will happen to me? Particularly young patients in their 30s, and now we see a lot of them. Maybe the third thing is, okay, I'll stop rice and sugar. And that's all that they know about that. There are so many myths coming in because of explosion of social media.
Yeah.
Unqualified people commenting on
Yes.
medical
Now
stuff. Everyone is an expert.
Yeah.
So people who do keto diets can do them for few weeks. And they come back saying, look, doc, I am feeling so irritable because the brain needs glucose. European Association, they say, look, you cannot do away with carbs forever. The best way is to reduce them a little bit. So even if you reduce your carbs by 10%, it will go a long way.
Okay.
If you can make it 15%, even better.
Great.
But don't try and give up carbs.
Hi. As clinicians, we see how diabetes can transform lives, but we also see how awareness can transform outcomes. Today, we are breaking down the essentials in ways that's practical, empowering, and myth free. Expect sharp facts, early red flags, lifestyle truths, and some eye popping signs along the way. Stay with us. This is the conversation about diabetes you didn't know you needed. Joining us today is Dr. Uday Phadke, an eminent endocrinologist with over 30 plus years of experience in clinical, academic, and research field. He serves as the Director of Endocrinology of Diabetes at Sahyadri Hospital, Pune, and is a graduate from BJ Medical College with DM in Endocrinology from KEM Hospital, Mumbai. A fellow of the American College of Endocrinology, he has been faculty for global academic programs by ADA, EASD, Johns Hopkins University, and the Mayo Clinic. He is also a respected teacher for the post MD fellowship in diabetes and DRNB endocrinology. Dr. Phadke has presented over thousands of nationals and international conferences and contributed extensively to reputed journals. Honored with ADA's Vivan Forensica Scholar Award, Inspiring Endocrinologist Award by Economic Times, he continues to contribute through his research, education, and compassionate patient care. Let's welcome Dr. Phadke. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Uday Phadke. Hello, sir. How are you?
Good morning to you and good morning to you all.
So welcome on Sahyadri Health Talks. And today we are going to talk about diabetes, which is a burning topic, and also India is slowly becoming the diabetes capital of the world. So we will talk about. We'll try to touch in the lifestyle part, the diet part, as much as we can. Also some discussion on the wearables and the technology part. But before I dive into the deep conversation into this, 30 plus years of experience and 30 plus years of your dedicated life to endocrinology, how has this journey been?
So the journey has been really interesting, and also in a sense quite foreboding, because one sees a massive explosion of illnesses related to metabolism, obesity, diabetes coming up in India in the past 30 years. You said that we are slowly becoming the diabetes capital of the world. I would disagree. We are very rapidly getting there and we will become it. And there are many reasons for it, of course. So I have seen this happen. But at the same time, let me say that I have also seen technology grow massively and solutions to a lot of problems in medicine emerging from this rapid growth in technology. So, as the disease progresses, as the lifestyle changes, so also is science progressing. So,
Yes.
we are seeing a two-pronged growth. It's
Actually,
very
I was coming to that. That was my next question. Actually, that 30 years you have given dedicatedly to Pune. So, how is the change from both the aspect of it? One is the patient's perspective in terms of awareness, how people are dealing with it now, and how was the situation 30 years back when you started the practice, and in terms of technology wise, how has this shift
grown.
been?
So when I started practice, diabetes, of course, was there in India for a long time. But at that time, Pune was not as bustling and as metropolitan as it is today. Today, you have a large number of people migrating from other states, other towns, different age groups. Pune has become very young now because there are
Correct.
lots of educational institutes,
Yeah.
IT hubs, auto
Yes.
hubs. So a lot of people
Yes.
come here and work. And the lifestyle has completely changed.
True.
So, I mean, I never had a automated two-wheeler till I joined or probably past my MBBS. So now, of course, you can see people have cars and we always cycle to school. I'm not glorifying this, but there was clearly a lot of exercise.
More physical
Eating
activities.
outside was a rarity. It was once in a while the family would go. Now you see, if you, in my lane where I stay, if I'm walking outside after dinner,
Mm.
I can see deliveries coming in till 11:30, 12,
11:30.
1. And then
True.
now Zomato and Swiggy offers all night
So
deliveries.
it's all about midnight munching and all
Yes,
that stuff.
absolutely. So things, television was restricted to one channel.
True.
Now you have television through the day. So people's lives have changed. You now work to US times. So they sleep during the day, work through the night, and all these kinds of change. So the whole demographics of disease also have changed.
Mm-hmm.
The demographics of population has changed.
Mm-hmm.
Food practices have changed.
True.
It's like a global village. You can eat what you want now. You
Mm-hmm.
can order an American fast food. You can eat litti choka. You whatever you want.
You name it and
You
you get
name it and you have.
True.
So it's very different now.
True. True. True.
And people have probably started living life, on a day-to-day basis. So let's enjoy today.
Uh,
कल का
कल की
देखा
कल
जाएगा, देखा
देखेंगे.
जाएगा कल क्या होता है.
True. So that was about the patients and how they were during those
Yes.
times. Now coming to the medical aspect of it,
Yes.
how has your practice been affected with the recent development of technologies and all that stuff? Why I'm asking you this is because I'm slowly coming down to precision medicine.
Absolutely.
So because I'll tell you, precision medicine or precision oncology is something which all of us have heard about. But precision medicine in diabetology, so help us understand this.
So first of all, medicines have clearly evolved.
Ah.
So when I passed out, maybe we had 2 or 3 different types of medicines. We had relatively old style meaning insulin, which was not really conforming to how nature produces it.
Uh-huh.
So difficult to give insulin at that time, and it would not match your natural profiles. So things have completely changed, and especially in the past 10 years, diabetes medicines have evolved so much,
Mhm.
and they're looking at each and so when I passed out, only 2 or 3 mechanisms of diabetes were known. Now there are more than 13 or 15 mechanisms known.
Mhm.
So as you unveil more mechanisms, you obviously develop a molecule which will target each of these mechanisms.
Mhm.
So
Mhm.
from 3 drugs, now you have 15 drugs.
Mhm.
The insulins have changed.
Mhm.
They've become more programmable. They can be used on an individual basis, what you require, what someone, a pregnant woman might require, some elderly patient might require. And that's how precision medicine has come in.
Mhm.
Initially, the most common diabetes that we have in India is called type 2 diabetes, right? And previously it was believed that type 2 diabetes is just one single monolith. It is no more so. In type 2 diabetes also, there are many buckets, as you could call them. There are clusters of patients who behave differently. Some of them are thinner, they are younger, they have higher sugars, they don't respond well to oral medicines.
Acha.
On the other hand, you have elderly,
Obese.
mild diabetics,
Okay.
a little obese, respond well to even diet or a mild dose of a oral drug. So you have these two extreme ends of the
Not
spectrum.
every case is
No,
same.
absolutely not. And you have people in between
Mhm.
who have a mixture of this.
Hmm.
And therefore, precision medicine has become very important.
Acha.
Because unless you identify the cluster to which this patient belongs, and also identify the prognosis, in the sense, how is this patient going to fare over the next 10 years?
Acha.
So, unless you know that, you won't be able to target that person exclusively and
Mhm.
aggressively.
Mhm.
So this is precision medicine.
Mhm.
What do I need to do for this patient?
Mhm.
Do I need to be aggressive? Do I need to be a little cautious and, you know, uh, rather conservative in treatment?
Mhm.
Do I use insulin in this patient?
Mhm.
Even if the sugar is a little high, do I push this patient?
Mhm.
But do I push a patient who is 30-year-old into more aggressive control? What should I do in pregnancy? What should I do in an overweight patient
Yeah.
versus a lean patient,
Mhm.
etc.?
The approach is
The
completely different.
approach is completely different. So you cannot just say, okay, diabetes, 1, 2, 3,
Hmm.
finish. That's
Yeah,
it. It can't be done.
it can't be done.
And also depends on what kind of problem the patient is having. Suppose the patient has a small kidney problem,
Mm-hmm.
my approach is different.
Yeah,
If the patient has fat in the liver, my approach is different.
true.
If he has a cardiac issue, my approach is different.
Mm.
All these kinds of things. So precision medicine has come to all branches. As you
Mm-hmm.
said, oncology now, it has really become molecule precision.
Mm-hmm.
In diabetes, we still have clusters
Mm-hmm.
of patients who behave similarly
Mm-hmm.
when treated. So we do identify those clusters and treat them accordingly.
So we have spoken about how technology has advanced, how the understanding about diabetes has changed over the past 30 years. What is that one thing which has not changed when it comes to patients' perspective about diabetes? Back then, 30 years back, also it was same, and today also it is same. What's that one perspective from patients' point?
So one perspective first, of course, is dismay. That how did I get diabetes?
Denial.
I don't eat sugar. That's it. Period. This has not changed, and it's amazing to see that. The second is fear. What will happen to me? Particularly young patients
Mm-hmm.
in their 30s, and now we see a lot of them. Is, oh my gosh, what will happen to me? What will happen to my children, my family? But over a period of time, what we have come to realize, and maybe the third thing is, okay, I'll stop rice and sugar. And
Yes.
that's all that they know about diabetes. So these things have remained the same.
Mm-hmm.
And then other things change.
Mm-hmm.
Our advice has changed.
Mm-hmm.
The way we counsel has changed. There are so many myths coming in because of explosion of social media,
Yeah.
unqualified people commenting on
Yes. Now
medical
everybody and
stuff.
anybody is
Everyone is an
talking about.
expert.
Yeah.
So that is something which we have to fight every day.
Yeah, I have all those questions listed down here.
Absolutely.
So I want to ask you that is, uh, what is that one thing you wish every patient understood about diabetes?
We make the patient understand that it's bad that you've got a disease, but you have got a disease which can be definitely now brought under control and kept at bay, and you will have a normal life.
Hmm.
So that's the first thing we started. You don't need to fear that, it's going to be a short life.
Yeah.
And this was a fact several decades ago where we did
Hmm.
not have effective treatments.
True.
So diabetes meant shorter life.
Mm-hmm.
Now, of course, if you do this correctly, you can live a good life,
Mm-hmm.
right? The next thing we try and inculcate in their minds is that, look, this is a chronic disease. You will have to stay with it lifelong.
Mm-hmm.
No matter how much noise is made about diabetes remission and resolution, etc., and we'll talk about that separately.
Mm-hmm.
But it is a disease which is going to stay, number one, and number two, it progresses.
Mm-hmm.
So no matter what you do,
Mm-hmm.
it will progress.
Mm-hmm.
The better you are able to follow your life, your lifestyle, keep your weight and diet and exercise under
exercise
control,
and control.
the less fast it will progress.
But it
It
bound.
will progress.
It is bound to
So
progress.
what you require today
Hmm.
may not be remaining the same next year or the year after that. So be
Hmm.
prepared for that. Don't take it as a failure.
Mm-hmm.
It's the way the disease progresses.
Hmm.
But we can still treat you after 3 years. So no matter how much you progress,
Hmm.
we are there to help you. So there is no hopelessness. It's like my diabetes cannot be treated. That never happens. I can treat it every time. The whole idea of treating diabetes, because so the first thing is they say is, but I don't have any problem. Why should I treat it?
Mm-hmm.
The whole explanation that we spend a lot of time is, today you don't have any problem.
Mm-hmm.
Even people with blood sugars of 300 and 400 walk around. They don't fall unconscious or they don't
True.
get dizzy, as is the common myth and perception. But we are treating this to prevent complications. So if your sugars remain like this, your organs will be affected, and someday you will become symptomatic, and then it's too late. So the whole game is about prevention. It's one of the few illnesses which don't trouble you but ask you to be vigilant. If you have cholera or typhoid or pneumonia,
Those
you know,
symptoms.
you're going to be ill and you
Hmm.
have to rush to the hospital. Diabetes never does that. That's
Very
a problem.
silent.
Very
Yeah.
silent.
Hmm.
And that's why you have to keep that faith that what I'm doing is
Mhm.
for my own good. It's not because the doctor is saying. Because this common myth is this is a disease invented by pharma and doctors. It's no more. It's not like that at all. It's a true disease. And I wish I don't wish, but I some way people could come and see our complicated patients, how much they suffer just because they have not taken care of their
At the
disease.
time when it was
And now you
required.
can't do much. In the sense you can do little for them.
Uh-huh.
Once they develop end stage complications, it's very difficult.
Very difficult to manage.
But it's preventable.
Uh-huh.
So that's what we try and inculcate.
Uh-huh.
And we give them very simple ideas.
Hmm.
We say, look, we are going to give you some very common sense tips on lifestyle. We are not going to make it too difficult for you. We'll give you something which you can follow, sit and discuss with us. But do it regularly. You don't do it for 2 days, 10 days, 2 weeks. This is not a course of 6 months. This is lifelong.
Lifelong.
And we'll manage your medicines properly. That's our responsibility. And the last thing we tell them is, please don't believe myths and fantasies and all kinds of rubbish that is spewed out.
Correct.
Come and talk to us. Ask your questions to us. We'll answer them. That's how it is.
Yeah. So maybe jot down all your questions when you come and meet your doctor.
Absolutely.
Rather than, doing the search on wrong places.
Right, exactly.
Note down all your problems, all your questions. Come and ask us, and we are there to help you out. Now, moving to the next section, which is, as you said, right, ki the most common understanding ki I have diabetes, let me quit rice, let me quit sugar, and I'll be fine. So, coming to the part where carbs are considered as an enemy, what do you have to say about carbohydrate intake for patients who are diagnosed with diabetes and things?
Yeah, a very, very pertinent question, particularly for India, because if we look at countries with large populations of diabetes, India is one where the proportion of carbohydrates consumed in food is probably one of the highest. So, by and large, if we look at our diets, what do we eat? We eat rice, we eat chapati, we eat pohe, we eat upma, we eat idli. Dominated. So about 65 to 70% of our food comes from carbohydrates. Okay, which naturally is going to raise the glucose because the illness is characterized by rise in glucose. So the more carbohydrate you eat, more will be the glucose. Now, on this note, can you totally do away with carbohydrate? You can for a short period of time, and people have experimented with keto diets.
Yeah.
So carbs going down to 5 to 10%. Yeah, sure. The sugars crash, and from 300 you can go down to normal.
But is it sustainable?
It is not. That's the whole problem. So people who do keto diets can do them for a few weeks, and they come back saying, look, doc, I am feeling so irritable because the brain needs glucose.
Yeah.
So the whole idea then is to stay a middle path. So what we tell people, and this has come from many different sources like the American Diabetes Association, the Indian Associations on Diabetes, European Association, they say, look, you cannot do away with carbs forever. The best way is to reduce them a little bit. So even if you reduce your carbs by 10%, it will go a long way. If you can make it 15%, even better.
Great.
But don't try and give up carbs. So suddenly people, after discovering diabetes, say, I'll give up this, I'll give up that. So all these fat diets, sirf protein khaunga. 2 weeks you can do that, but then you'll get miserable because that's what you have been eating all your life, and that's what you are used to. So you cannot suddenly
don't try to do things which you cannot
try
sustain.
to do things which you cannot be comfortable with.
Yeah.
What your mom or your wife can't cook for you. Don't be exotic.
Wanted to talk to you about, as you spoke, keto diet, intermittent fasting, and especially this intermittent fasting part, where you eat during a certain window and you don't eat during the other part of the day. But for a patient who is diabetic, he needs to take medicines, maybe a dose in the morning. For some, it is thrice. How does somebody manage
All right.
that with intermittent
So
fasting?
I'll quickly break it down. When you say intermittent fasting, there are two ways of fasting. Okay. One way of fasting is actually to eat in a limited time window in a day,
Hmm.
say between 8 a.m. to 2 p.m.
Hmm.
And then from 2 p.m. to 8 a.m. next day,
You don't
I don't consume anything.
anything, yeah.
That is actually called time restricted eating.
Acha.
Okay. When I say intermittent fasting,
Mm-hmm.
I mean that if you have 7 days in a week, 4 days I eat normally,
Mm-hmm.
and the remaining 3 days I either eat nothing,
Mm-hmm.
which is very difficult,
Mm-hmm.
or I consume 50% of what I eat on day
On
other 4 days. So
normal.
it's like 4-3.
Hmm.
This is actually called intermittent fasting,
Okay.
right? Now, ultimately, both of these
Mm-hmm.
will make your sugars better. It will help you lose weight.
Mm-hmm.
However, if you also reduce calories, suppose you're consuming a 2000 calorie diet today,
Mm-hmm.
and I say, okay, now make it 1400, it will work the same way as these two other diets.
Acha.
However, some people cannot, bring themselves to eating 1400 every day.
Hmm.
So they say, no, I am in the habit of munching.
Hmm.
So let me put this restriction on myself that I'll not eat between 2 p.m. and or whatever you decide.
Yeah.
For them, it works that way. Some people say, let me eat normally on 4 days. 3 days, I promise you, I'll eat less.
Hmm.
For them, that works. For someone, for example, for me, I think eating less every day is better than eating normally on one day and eating less on another day.
Yeah. Yeah.
So
Yeah.
it is very individual. And it's not like the holy grail that intermittent fasting is the only way you can.
Solution to out of it.
Right. Now, the second part of the question, for those who are not on medications, they can choose either.
Yeah.
It doesn't matter because they are not on medicines.
Yeah. True.
But those who are on medicines, particularly those on insulin or other medicines like sulfonylureas, where the sugar tends to come down,
Mm-hmm.
I would rather have them eating regularly at 6-hour intervals
Okay.
rather than staying hungry through the day because the sugar will crash.
Hmm.
So it's very individual. So you cannot make a blanket statement that this is for you, this is for somebody else,
Yeah.
without considering anything else. You have to look at their age, their
Yeah.
frailty, what is available, what is not available.
Then
Suppose
again,
he is
actually,
eating in a mess.
we are again boiling it down to the same thing that, if
Precision medicine.
intermittent fasting or a restricted diet has worked for one person,
It may not work for the
necessarily
other.
it will work for you.
Absolutely not. So I had a builder, a reputed builder, who tried this, this time restricted thing. And he would sit in his office in the evening. And one day he was very gung ho about it in the beginning.
Acha.
After a few days, he came and said, I'm giving this up. I said, why? You're doing well.
Mm-hmm.
He said, I shouted at my customer, which is like complete no for a builder. I'm selling flats here and I'm shouting at my customer. How will this? And I realized that I was irritated because I had not eaten.
Correct.
So he gave it up. So it's very individual.
True. Okay, sir. So that was about the carb and the intermittent fasting and the keto diet and all that stuff. Now, I'm very sure many patients would have asked you, sir, एक सुपर फूड बता दीजिए जो खा के एकदम my sugars will be in great control. कुछ फ्रूट मैं मेथी पानी पी लूं क्या? मेथी पानी पीने से सुना है कि एकदम ठीक हो जाता है. So what message do you have for all such people, or do you actually have some superfood?
No. So my message is, don't look for any super magical thing for any disease whatsoever. Forget diabetes.
Acha.
It is a very balanced kind of thought out process. So there is no magical food like that. At the same time, there is no enemy food also. I mean, of course, one would like to avoid very carb and loaded fat things like mithai and all that. But otherwise, there are so many myths like mangoes and rice.
Yeah.
We talk to them. What
Yes.
is the fact about these things? But there is no one single super magic food, etc.
Or super enemy food apart from heavy loaded carbs and
So, when we look at people's wearable data, one thing which really brings out sugars is pizza.
Pizza.
It's a load, it's a bomb. So it
Hmm.
has lots of carb and lots of fat,
Ah.
and together it's it's a real bomb. So when we see traces
Uh-huh.
on the CGM, the variables that you're talking of, pizza comes out very much on the top.
Very much on the top. So, what message do you have for all those people who are trying to, balance their food and diet and trying to bring their glucose in control? What would be a message that you want to give
My
to them?
message is use a common sense, no nonsense diet. Don't fall prey to fad diets. Okay, fad diets always work for a short period of time.
Hmm.
They're non-sustainable.
Hmm.
They ask you to omit this thing or add something exotic,
Hmm.
which doesn't work over a long period of time.
Hmm.
My advice is sit with a good dietitian, discuss your present plan of diet,
Hmm.
and see what you can change, rather than just go to a dietitian and give me a diet plan which is totally contrary to what you are doing today. It doesn't work. You have to learn to change a few habits. Okay, that's what is important, and there the dietitian will help you, because see, in India there are so many cultures of diet.
Hmm.
A Marwadi may eat different from a Punjabi, from a Maharashtrian, from a South Indian. How can
True.
you have the same diet for all? It's not possible.
True.
So that is not what we aim at, and therefore the job of a nutritionist is to sit, identify the current diet, see where the fallacies are, and try and correct some of them. That's the whole idea.
Sure. So the whole point here is don't try to go for short-term plans
Correct.
which you cannot sustain for longer.
Absolutely.
Go for something which you can easily incorporate in your diet and try to follow that.
Very much true.
Okay, so on that note, today we have discussed about diet, nutrition, precision medicine, and we have lots more to discuss, which we will continue in our next episode with Dr. Uday Phadke. Until then, this is Dr. Tushita signing off Sahyadri Health Talks.